Okay, this is chapter 15, which is your integumentary assessment or skin assessment that we're going to be talking about. Okay, we're going to talk about the layers of the skin. So you're looking at a picture of the skin. First layer that we're going to talk about is the epidermis. The epidermis has the job of protecting the tissues from physical, chemical, and biological damage. It prevents water loss and serves as a water repellent. It stores melanin, which protects tissues from harmful effects of the ultraviolet radiation in the sun. The other part of the epidermis is it is the outermost layer. Now, what gives that epidermis its tough, protective type quality? That's keratin. So when we also talk about the skin and we're talking about the different layers of the skin, then we're going to go down to the dermis. So when we talk about the dermis regulates body temperature by dilating and constricting the capillaries. It also transmits messages via nerve endings to the central nervous system. The other thing is we want to know what is located in the dermis. That is your hair follicles, your sebaceous glands, and your sweat glands. When we talk about the skin, we talk about alterations in the skin is an increase for what? Fluid electrolyte imbalances, temperature, infection, wound healing, and self-concept. What protects the body from infection by killing bacteria? That's the sebum. Color that is influenced by emotions and illness. So these are the different terminologies that you would maybe use to describe skin color. So you have erythema, which is your redness, and you have your pallor, which is extreme paleness, cyanosis, which is your blue color from poor oxygenation of the hemoglobin, and then you have your jaundice, which is the yellow to orange tinting that you can see. These is usually, that color to the skin is a result of hepatic disorders. When we start to talk about assessing the integumentary system, it's assessed by diagnostic test, health assessment, interview, and physical assessment. The nurse is responsible for explaining any types of procedures that may be done on the patient in regards to the integumentary system, any special preparations that they would need to make prior to the test. They also would need to assess any medications. So for example, if you have a patient who is coming in and they're complaining of a rash and itching, one of the questions you may have to ask them is, did they start any new medications? Did they change maybe their laundry detergent? Questions like that, anything maybe they had changed recently that could cause this type of a reaction. You're also going to support the patient in any kind of procedures that they may have to have if they're having a procedure done and they're having to take a scraping from the skin. That's not very pleasant, so you're just there as support for the patient. Always documentation and always monitoring the results. These are some genetic considerations. Instead of putting the terminology up here, I put the pictures. In the upper right-hand corner in the picture that I just starred is a keloid. Keloids are elevated scar tissues. They do have a familiar tendency. The picture down in the lower right-hand corner is called vitiligo. This is where you have white patches on the skin. The picture in the middle, in which I just starred, is your Hirschism. This is excessive hair in women. This may be genetically predetermined. And then your picture on the far left-hand corner is your bruxism. This is where they have that white hair, the white eyelashes, the white eyebrows, um, and that also is a genetic consideration. Now we're going to go through some of the diagnostic tests that can be done for the integumentary system. I tried to pull up some pictures for you guys, but there wasn't really a lot of good pictures or anything that really came up to put with the test. These are kind of pretty straightforward also for the most part. The first one we're going to talk about is the skin biopsy. This is where they actually take a piece of skin as a puncture, and then what they do is they usually use an instrument that's used to remove a small section of the dermis and the subcutaneous fat. Depending on the size, the incision may have to be sutured or may not, depends on how much they have to take. So it is an incisional biopsy that they're taking. They usually will take this sample and they want to differentiate between benign lesions versus skin cancer. As far as nursing interventions, you may have to apply a dressing and provide information about self-care, and you may have to instruct them when they would need to come back for sutural removal if that was necessary. There's no pre-skin biopsy instructions that you would have to tell the patient. Then the next one we talk about is the immunofluorescent slides. What these are a sample is taken from the skin or the cerebrum, and it may be done to identify an IgG antibodies and identify varicella in the skin cells, which is we're looking for the herpes zoster. What they do is they take the samples, put them on a side, and then they look at them under a microscope to determine what the actual skin sample is. There is no special preparation necessary before or after for this particular test. The next one that we're going to talk about is the patch test, also known as the scratch test. This is used to determine any specific allergens. A small amount of the suspected material is placed on the skin, and then they put a dressing, usually an occlusive dressing, so that they can see over top of it. That's in the patch test. In the scratch test, a needle is used to scratch small amounts of the potential allergen onto the skin. What they're doing is they're doing this in small amounts to see if your body reacts to it, to see if it is a true allergen or not. As far as nursing considerations, you would need to explain to the patient that they need to return in 48 hours to have the patched area or scratched area evaluated. The next test that we're going to talk about is the Woods lamp. What they do is they use ultraviolet light that causes certain organisms to be fluorescent. One of them is Pseudomonas and fungi. And then the skin is examined underneath of this special light. Then when we talk about cultures, this is where they're taking a scraping of a lesion or drainage to identify fungal, bacterial, or viral infections. Nursing considerations, you would need to obtain the culture with a sterile culturette, swab, or a culture tube, and maintain strict asepsis. You don't want cross-contamination of your body fluids or your staff with that particular culture. The next thing we're going to talk about are oil slides. The oil slides are used to determine the type of skin infestation present. Scrapings of the lesions are placed on a slide, then they put mineral oil or oil and examine it microscopically. There is no special preparation for this particular test prior or after. The next test is potassium hydroxide, also known as KOH. This is a specimen is taken from the actual hair or the nail, because when we talk about skin disorders, we also include hair and nails into that particular system. It's examined for a fungal infection. They place a scraping on the slide. They add potassium hydroxide, and then they examine it under the microscope. There is no special preparation for this particular test. Then the last test we're going to talk about is the Teesnack test. This is used to determine herpes infections. It does not differentiate between herpes simplex from herpes zoster. They usually take fluid and cells from the vesicles, and they put it on a slide, stain it, and then look at it under a microscope. These tests, all of them that we just talked about, are on page 395 in your chapter. And for the most part, you can see that the common theme is a lot of things, scrapings or a biopsy or fluid is taken and then it's looked at under a microscope when we're talking about skin disorders.